back to Liv'n Life Unfiltered, the podcast where it's a health and wellness conversation with a friend, except we brought the expert too. I'm your host, Kendall, and today's conversation, you've heard it's on all over social media. Names like Wegovy, Ozempic, Zepbound, or Manjaro, these medications have become a major conversation everywhere, from social media to celebrity headlines. Some celebrities that I put and I researched and found a lot over who's taking these types of supplements is Shaq O'Neal, Serena Williams, Oprah Winfrey, and they have experiences with GLP-1 medications, which has only increased public interest. But with all the attention comes a lot of questions about these, about GLP-1s, and maybe there's some confusion and misinformation. And are GLP-1s just a weight loss trend, or are they changing the way that we approach health? And to help us separate fact from fiction, I'm joined by Dr. Kenneth Wu, and he is the Chief Medical Officer at Vitality. Dr. Wu is a dual board certified in anesthesiology and interventional pain management. He trained at Baylor College of Medicine and Rush Medical Center and has held leadership positions at UT Physician Center for Healthy Aging and Memorial Hermann TIRR Rehab Hospital. Throughout his career, he has helped patients manage chronic pain, neurological injuries, and complex medical conditions to improve their function. Today, he helps patients improve their health through a comprehensive wellness clinic that focuses on preventative care, weight management, and medical risk reduction. Thank you, Dr. Wu, for being here. Before we get to everything, I usually dive into kind of what exactly are GLP-1 medications and how do they work in the body. So can you explain what GLP-1s are?
Absolutely. Thank you for having me, Kendall. So GLP-1s are what we call peptide hormones. They are hormones. Hormones is a type of molecule that actually is secreted by a body area to tell what the other body areas are doing. So, for example, hormones give distal signals to the other parts of the body. One of the most famous or common hormones that everybody may know is adrenaline. So adrenaline is often used in fight or flight responses. So when people get scared, they make adrenaline. So what does the adrenaline do? It's made by the adrenal glands, which is a little gland on top of the kidneys. When you make adrenaline, it's telling the brain to speed up the heart, to make your muscles have more blood flow, so we're either ready to fight or flight. It's a type of hormone. So these molecules kind of signal something to the other areas of the body to say, hey, we need to do something to make certain things happen. So adrenaline would be a really good example of what a hormone is. Now, GLP-1s is a type of hormone, but it's usually secreted by the gut. So as opposed to adrenaline, which is really made by the organ that's above the kidneys, gut modulation or gut stuff is related to, the sense of being full, the sense of digestion, and things like that. So GLP-1 is a type of hormone called glucagon-like peptide. It's a hormone that's made by the gut to tell the rest of the body, hey, I'm kind of full, okay?
Right. And with all these people kind of talking about these medications like GLP-1s, and now that you've explained it, many people wonder if they are right for them. So who is typically considered a good candidate for GLP-1 medications?
So GLP-1s have been on the market for quite some time now. The main reason that GLP-1s are made is actually for diabetes. That was the first indication because it really causes the body to release insulin and it brings down the blood sugar in the body. So the initial indications, like some of the earlier GLP-1 medicine, Rybelsus is one of the oral medicines that's been around for quite some time, is actually on label for diabetes. But people then find out, it does something to actually curb hunger or makes people feel like they're full. And now it's being used for weight loss because people who feel full doesn't want to eat. So it's being used more for that.
Right. And talking about GLP-1s, we understand that these medications, how they work. One misconception I came across for GLP-1s are they're unsafe and come with numerous dangerous side effects. This is one of the biggest concerns, and that's probably why a lot of people get kind of scared to take these medications. So what is the truth behind the safety of GLP-1s? and what should patients actually know about the potential side effects when taking GLP-1s?
Absolutely. And it's such a big topic, but when it comes to talk about any kind of medicine, there are the good, the bad, and the not so great or the ugly, so to speak. I would say GLP-1s, yeah, everybody use it for weight or diabetes or obstructive sleep apnea or some of the other stuff, but no drug is going to come without any side effects, right? So the key is how do you select for the right patient for this drug rather than saying, oh, the drug is good for everybody or the drug is bad for everybody.
Right.
The key is, we have to do some risk stratification and see if you're a candidate for this, just like surgery. When you do things, you have to say, well, is this patient a right medical fit for this drug? So some patients are and some patients are not. And it's important that during the initial consultation with your doctor, we go through a medical checklist as well as lab work to make sure, yeah, what you have, the GLP-1s will likely make you feel better. And also, I would say continue monitoring, right? GLP-1s is not something that you just give and that's it. You get one shot every week and there's no consequences. Well, the body can change. And the body may develop other side effects that we have to monitor you for. So routine follow-ups and blood work may be needed to make sure you're actually doing well in the GLP-1s and not doing poorly or have other medical problems that arise from the GLP-1s.
Right. And like you mentioned, everyone's bodies are different. So doing all that testing is really important. In another episode, I talk about lab work. So hope you guys watch that video. So another question that people often have when they're thinking about GLP-1s is why some individuals see dramatic results while others may not experience that same level of the weight loss. And not everyone responds to GLP-1 medications the same way because everyone's different. So research shows that about 10% to 15% of patients across studies of Ozempic and Manjaro fail to lose at least 5% of their starting body weight. So why do some people respond very well to GLP-1 medications and some others may see different results?
So one thing is, people think of, weight gain is due to, something that GLP-1s can magically fix. It's
Yeah.
not. People have weight gain due to other reasons. For example, thyroid. If you have low thyroid hormones, people gain a lot of water weight, right?
Mm-hmm.
People who have irregular periods, maybe they have endometriosis or polycystic ovarian disease. In those cases, these patients may have really, really high estrogen levels and not enough progesterone. People may have adrenal disorders that make them gain water weight. So
Right.
GLP-1s is really indicated for people with insulin resistance, where the A1C is a little bit higher, or they are just eating a little bit more too healthy, so to speak. Those
Yeah.
candidates are actually going to respond to GLP-1s, but that's why it's so important to go in and talk to the doctor. We can get blood work and other lab tests that's needed to make sure you are actually a good candidate for GLP-1s. For patients that are not getting any weight loss from the GLP-1s, perhaps we're barking up the wrong tree altogether.
Right.
Maybe additional testing may be needed.
Right.
Right.
And today, GLP-1 medications are available in many different areas. I mean, it's kind of crazy how social media plays such a role in online because people can buy them anywhere, even online for companies. And for someone who's considering treatment, it can be difficult to know what is the best type of care and who they should go to. So why would someone choose to work with a provider at Vitality instead of getting a prescription online only services?
I would definitely caution the viewers and the people who's listening to this podcast to go to online only services. I think routine follow-ups are very important. Routine lab work and even the initial consultation can really make or break your treatment or developing side effect.
Right.
Remember, the doctors online, they're not able to see you in person. They cannot do a physical exam. And there are certain things that they may not be able to pick up with just a camera. They are not going to be able to do an exam. They're not going to be able to get a good vital sign. I really think these initial consultations should be done in person, and routine lab work needs to be done to make sure you are appropriate for GLP-1s and to make sure you don't develop really negative or dangerous side effects from these medications.
Right. And when it comes to weight management, medication is just one part of that picture. So beyond weight loss, what other health benefits does GLP-1 medications have are valuable and for the right person?
So it's funny that you mentioned that. I think one thing that GLP-1s are now coming on label is actually obstructive sleep apnea. Sleep apnea is usually caused by additional tissue in the upper airway, in the neck or in the back of the throat.
Yeah.
And GLP-1s is becoming even helpful for that. I had some ear, nose, throat doctors, friends that I have that used to do a lot of procedure called the Inspire procedure. Inspire procedure is used to stimulate some nerves to the back of the throat to help people not obstruct during sleep. Well, the GLP-1s has really caused them to reduce the number of cases that they have because it really works for sleep apnea as well because it reduces the tissues on the back of the throat. In fact,
That's interesting.
Zepbound is on label now
Yeah.
for certain
Wow.
insurance carriers for obstructive sleep apnea. So there are other indications that the FDA is looking at and the drug companies trying to get on label, but GLP-1s can definitely do a lot. Another study is, to look at fatty liver. Some people have a condition called fatty liver, not due to drinking, but just due to overnutrition, caloric intake. Their livers kind of get yellow and juicy, so to
Ew.
speak. So that there has been some instances where GLP-1s can reverse
Right.
the micro liver trauma that people have. So
That's
definitely very,
interesting.
very exciting stuff.
Yeah.
Yeah.
And one of the biggest questions I think too, after they take these medications and they reach their weight loss goal, they're kind of like, okay, what happens now? And according to a National Academy Medicine article, it says someone who's taking Wegovy may lose about 12% of their body weight on average, but if they stop taking the medication abruptly, they may regain about 2/3 of the weight they lost. So weight loss is just about reaching a number on the scale, and then it's also about creating long-term changes for your bettering your health. So once a patient reaches their goal for their weight, how does Vitality help them continue their health journey?
Right. So while we're helping you lose weight, we always want to do concurrent nutritional counseling at the
Right.
same time. We want to teach you how to eat better because GLP-1s, you're absolutely right, Kendall. Once you stop the medicine, a lot of people just gain it right back. I mean, like I said, it's a hormone, so we're tricking your body of not wanting to eat. But once the medicine is gone, people's hunger do come back sometimes. So it's important about just, yes, we can make you look better, feel better, the numbers come down, but we need to give you also tools where it doesn't regrow back,
Right.
or else you're going to be dependent on
Yeah.
GLP-1s for a very long time.
You're avoiding those like bad eating habits.
Mhm.
But some patients, is it okay to get off of GLP-1s? Like, is it safe to discontinue it if they don't want to follow through anymore?
Yes, some people can get off of a cold turkey. Some people may need to be tapered down.
Right.
Because as you know, GLP-1s, one of the side effects actually, slowing down your gut. So
Right.
as soon as the medicine is stopped, people may feel their gut moves really, really fast. It can create nausea. It can create a lot of diarrhea,
Right.
a lot of other GI symptoms. People may go in through sweats and stuff like that. So there are other side effects. So there is some patients that go through withdrawal-like symptoms when they abruptly discontinue the medication.
Right. And for the future of GLP-1s, they were originally, like you said, for diabetes, but today most people think about GLP-1s, they hear just weight loss, but I did more research, kind of diving in more, and they can be used for a lot more than just that. A recent review published article in Cell Reports Medicine found that GLP-1 medications can improve outcomes for people with cardiovascular disease, kidney disease, liver disease, and obstructive, like you said, sleep apnea. Yeah, I couldn't say that word.
It's close enough.
As we continue learning more about these GLP-1s, like what are you looking forward to for the future of GLP-1s and like what are you most excited about?
I think it's interesting because it's a hormone molecule. It can affect more than one organ.
Right.
So as we progress on research, we may find other organs that may find benefit. It does reduce cardiovascular risk because studies have shown if your blood glucose is high, it actually creates microvascular injury, which may lead to increased risk for strokes and cardiovascular events like heart attacks and things like that. So definitely it has a good impact or positive impact on other organ systems as well.
Right. And I think it's just really exciting to hear all this new studies coming out. There's been recent improvements and it's really fascinating. And I know the FDA regulations can be a lot because it is scary. What advice would you give to someone who's kind of nervous, but they really want to go on GLP-1s and they really want to better their health?
The key is just make sure you get a good, thorough medical evaluation on the first visit. Sometimes slowing down the gut too much can lead to really dangerous side effects as dehydration. I have many patients who sort of forget to eat or drink because of the GLP-1s. It's working a little too well.
Yeah.
Their kidneys started failing because they don't drink enough water. People may have some cosmetic related side effects. They lose so much weight. We call it the Ozempic phase, right? You lose all the buccal fat or the cheek fat really, really quickly, and then they need stuff to prop it up. Some people develop pancreatitis, which is a really life-threatening condition where your pancreas is inflamed. Those hurt and people vomit, they have fevers. It may land them in the hospital too. So make sure the key is pick the right patient for GLP-1s, keep them safe by continue to monitor them. That's how you do peptides and GLP-1s and things like that. It's not about just getting at the gym or getting it from somewhere online, not having any follow-up. The key is it is a drug, and drugs can be helpful, but they can also be dangerous at the same time.
Right. And I think a big takeaway too is just like, don't trust what social media says. I know a lot of influencers take these so Dr. Wu, thank you for being here and answering all these questions today and helping us understand more about GLP-1 medications and peptides as well. I think the biggest takeaway overall is that it's a trending topic. It really is a big topic, and I think that they are powerful medications. They're a valuable tool to help us have long-term health benefits. However, you have to have the right guidance and the proper care to complete that approach to your health for the future. And thank you for listening to Liv'n Life Unfiltered. If you enjoyed today's episode, be sure to subscribe, comment down below. And until next time, this video is produced and owned by Vitality Hormones and ID Bar.